Yes, so Shirley here is missing some teeth. So we're making her partials on the top and the bottom. And today we're doing what's called the tooth try-in visit.
Today, Shirley Ruiz is getting some brand new teeth. Dr. Vicky Petropoulos makes sure the so-called partials fit just right.
Gently close, Shirley. Thank you. Gently close. Good. Very good.
Shirley Ruiz has terrible teeth. She never really took care of them.
Not brushing regularly. I didn't really floss because my teeth were really crooked, and so it was hard to get, the dental floss in there and that. So yeah, tooth decay, and really not eating right neither.
Combine that with the fact that Ruiz just couldn't afford to see a dentist, even when she was working. As a result, Ruiz suffered for years.
Hard to eat, because like I said, I can't chew nothing over here. And then I would have pain in my teeth for chewing too much on this side.
But thanks to the Senior Dental Center, Ruiz is getting her long-neglected oral health needs addressed. The clinic is on the second floor of the Gary and Mary West Senior Wellness Center in downtown San Diego. The Wellness Center is like a one-stop shop for seniors. They can get 2 meals a day, see a doctor, and have access to financial and mental health counseling. The dental center is funded primarily by the Gary and Mary West Foundation, which put up $2 million to get the clinic off the ground.
We are addressing the whole needs of a senior.
Shelley Lyford is the foundation's CEO. She says the West came up with the idea when they were serving meals to seniors.
It was during their interactions with seniors that they actually discovered seniors covering their mouths when they would talk to them, and actually, even though the seniors were often malnourished and very hungry, they were not able to eat the food that Gary and Mary were serving.
Most of the patients at the Senior Dental Center live below the federal poverty level. Their mouths tend to be in horrible shape.
Here we have root tips that need to be extracted.
The clinic's dental director, Dr. Karen Becerra, points to an x-ray of one of her typical patients.
This patient had an abscess in that area, came with pain. They have lots of missing teeth. The bite is completely off on that side. This teeth has come out. If you see, lots of bone loss in the upper and the lower.
Becerra says these problems could have been taken care of years ago with much simpler and less expensive treatments.
Good morning, Ron.
Now, it's up to Becerra and her colleagues to restore patients' oral health as best they can. All of the services are provided on a sliding scale, based on a patient's ability to pay. The clinic has treated more than 350 people since it opened last June. But Becerra says because of high demand, many patients have to wait months to be seen. She says our society needs to do better by its seniors.
The longer we wait in providing the services that they need, the more it's going to cost us all. The more that their quality of life is going to be affected, the more that they're going to have disease that is continuing advancing. We're trying our best, but we only have 4 chairs.
Low-income seniors can qualify for Denti-Cal, California's dental program for the poor. The problem is most dentists won't treat Denti-Cal patients. That's because the reimbursement rate is so low, it doesn't even cover their costs. The Gary and Mary West Foundation wants to find out if the dental clinic is viable. The foundation is collecting data on a variety of fronts. Researchers want to see if the center could improve its operations and become more efficient. They also want to find out whether a dental intervention makes seniors happier and improves their quality of life.
What we're doing is shining a light on the problem. We're providing more access to seniors. We're catalyzing some really important public-private partnerships. We're collecting the data, and in order for us to be sustainable and not depend on philanthropy, we're going to have to change policy.
It remains to be seen whether the government's tight-fisted policy toward funding senior dental care will change. In the meantime, patient Ron Hilton is just thankful that the Senior Dental Center exists. The clinic is giving him a new set of front teeth.
I'm on fixed income, Social Security. I don't have thousands of dollars extra under the mattress, so this has really been great.
The nonprofit Oral Health America says more than 70% of seniors have gum disease, and about 25% of adults 60 and older no longer have any natural teeth. The Senior Dental Center is trying to take a bite out of those numbers. Kenny Goldberg.
I am happy with what I am seeing.
KPBS News.
That's good. All right, let me take it out. And then we'll go from there. All right.